We're going to give ourselves a couple minutes to allow everyone to register into the event. And so we'll get started right here about 10:01. We've got a lot of material to cover, and we'll go from there. There's no one in yet.
447 people registered.
I'm not sure if I got cut off there in my intro, but good morning, everyone. I hope everyone is safe and their families are safe. We've got almost 450 people registered for today. So we're going to give it just about 10:01, and then we're going to get rolling. While we're killing a little time here in the beginning, maybe you've noticed our ready to serve sign here over my shoulder. We are going to be providing that logo and some checklists and some things for your windows for your customers, so we can brand our industry as ready to serve, and we'll be getting going from there. Looks like we're starting to get some critical mass of everyone on board, so I'll get started at 10:01. Can you bring up the chat room, Lex? So I can have a sense of where it's at. Right. Good morning. All right, people still coming in, rolling in here, and watching that number click up. I feel like I'm watching the countdown to New Year's Eve or something there, but we're good to go, and folks can catch up. Hope you can hear me okay. I'm Anthony Antone. I'm a humble servant here at the Hospitality Association. We are excited today to be able to tell you what our requirements are going to be to reopen. And Lex, it's not flipping screens for me on the computer. There we go. Joining me today from our team is Julia Gordon. Julia is our very talented Director of Government Affairs here at the Washington Hospitality Association. Hi, Julia.
Good morning.
Also from our team is Samantha Louderback. Hi, Sam.
Good morning.
Sam specializes in health department and other issues here at the association. Sam is going to be our chat room monitor today, and I'll talk more about that in a minute. The association is blessed to have two agency experts with us today. Pamela Gant from the Department of Labor and Industries. Hello, Pamela. Pam. And Joe Graham with the Washington State Health Department, and been working with Joe for years and making sure we have clear health department rules and regulations. Joe, thanks for all your support over the years.
No problem. Thanks for that welcome.
You probably know there are 21 requirements or guidelines released by the governor's office earlier. Was it this week? I think it was this week. And I've lost all track of time. We're only going to be covering 19 of those today. One of them is very specific to the Liquor Control Board, and the Liquor Control Board is developing many of the guidelines to how you can serve in your lounge and your bar if you have one of those, and what you'd be restricted from. So we will be having another webinar with the Liquor Control Board as soon as we can get it scheduled, because we know that these requirements will affect you there. So we have a bunch of questions ready to go when we have our webinar with Liquor Control Board. We're also not covering one of the more talked about requirements, which is the customer registration piece. We are still working with the governor's office on the guidelines and what that might look like. And so hopefully soon we will be able to talk to you about what's going on in that area. However, there are 19 other things to cover, and if we're able to get through 19 requirements and guidelines in 90 minutes, I'm going to say that was a great use of time. So the overview of today's format, we're going to go over with the health department and with L&I. They'll each have about 45 minutes for the requirements and guidelines in those areas. We took questions from many of you ahead of time, and for the about 2 in each area that got the predominant number of
Hey,
questions.
Anthony,
Yeah.
we're getting a lot of comments on the feedback, and so if you are not speaking, could you please turn your mic off?
All right. Was that better? Okay. There you go. Thank you, Sam, very much. Anyway, let me try that again. We're going to spend about 45 minutes with both the health department and then L&I. Yeah, that's the order. And then for our requirements that have gotten the most questions, we're going to spend 10 minutes on each of those. 5 minutes on each of the additional requirements that have had questions. And some of these things are straightforward. So we're just going to bring up the list and see if you have any additional questions, even though we haven't gotten any in. Sam will be monitoring our chat room. So if you have a question when that requirement comes up, she will be the ones marking it. If it's a simple answer, Sam will go ahead and let you know the answer. If she thinks it'd be great for everyone to know, Sam will be raising your question to us as we run. With that being said, let's get forward because we've got a lot to cover. One more thing I did want to say. If we can't get to all of your questions in that time frame, please still type in your questions. We are going to be tracking all of these and coming back to the agencies and getting answers and getting those answers up on our website. And so even if we don't get to your question, please don't get too frustrated with us. We are going to take advantage of these great relationships we have, get your questions answered, and get the Q&A up and out. Also, please stay in contact with your membership staffer that you work with, whether it's your area coordinator or your territory manager, and they'll also be getting questions in as we go. So with that, I'd like to start with the health department. Joe, you're gonna be up first. This is the tables requirement, and the requirement that tables have to be a minimum of 6 feet away from other guests at the adjacent tables, or where you are allowed to have a physical barrier wall between the booths or tables. This is the one question we've gotten the most about. Julia, can you ask the first question we've gotten from our membership on this requirement?
Sure, Anthony. Let me pull up the questions.
Okay. I've got one while you're finding it, Julia. I think, Joe, at this point, is there a definition of what a barrier is between booths? Is there a certain material or other things that it has to be? Or is it simply just a barrier between where guests are sitting?
The standard would be that it's something that's easily cleanable, non-absorbent. I mean, a piece of cardboard would not work because you can't clean that. And I know a lot of people are using plexiglass, but anything that's smooth, non-absorbent, and cleanable should suffice. Awesome.
I think that's pretty clear for most folks. Julia, you got the next question?
Yeah, I apologize, Anthony. I think another question we're getting from our membership is, and we've seen some diagrams in other states, like posting or adding some sort of shower curtain or I say not physical, but maybe cloth barrier. And it's our understanding that that would not be compliant with the physical barrier. Is that the health department's understanding as well?
Yeah, that's the understanding as well. Again, it goes back to the ability to clean that and the absorb, and that can absorb.
Great, thank you for that. And then Anthony, I think the other question we're getting as well is the height of the barrier. How tall of that wall or barrier is appropriate in this scenario?
I actually do not know for sure. It's going to be hard to actually give a height. I mean, a rule of thumb would be that it can, the point of it is to disrupt any kind of aerosolization. If someone sneezes or coughs, I mean, is it in a position that it would stop that, the aerosol from someone's mouth getting over into the adjacent booth? So an exact height's going to be varied. I mean, how high is the booth? How high are the chair backs? those things are going to affect it. So to me, it's going to be just making sure that it actually can, serve its purpose, which is to stop, the spread of the aerosols from one dining party to another.
Joe, I want to follow up on that one because I think a lot of people are going out and buying plexiglass and making the expense and doing some construction. Is it probably fair to say at least over someone's head? And so
yeah, so if someone were to stand, I mean, this is probably not going to happen, but if someone at an adjoining table was to stand up and sneeze or cough, that needs to be able to intercept that.
Okay. So between the booth and the plexiglass, get to the point where someone's standing next to the booth, it would be generally over their head.
Correct.
Okay. Thank you. Julia, want to take the next question, or you want me to read one off?
Yeah, and I think importantly too, when we're talking about physical barrier, are we talking about a solid surface? Seeing some questions in the chat about bamboo or a wooden, I think probably more aesthetically pleasing option. Do you have any guidance or thoughts about that as well?
I mean, the bottom line is, I mean, like, it has to be solid. You can't have perforations, holes. And also, again, the standard is going to have to be that it's cleanable. So if it's cleanable and doesn't have perforations, and I want to stress, and Anthony makes a really good point about, you're going out right now, we have businesses that are pondering, how am I going to do this? And I'm going to buy stuff. Please do not hesitate to reach out to your health departments and ask them, hey, look, here's either a picture or here's an idea of what I'm thinking about. Will this work? They're pretty overwhelmed and they will try to get back with you. But if you need a sounding board, try to your health department and see if they can't, answer your specific questions. But in general, got to be the correct height for again, what we talked about a minute ago. It's got to be cleanable and it can't have, holes, slots, perforations, and those types of things.
And if people could CC us when you ask your health department, that way we can get the collections of answers and get help relieve your workload, Joe, and your counterparts' workloads and getting consistent.
Yeah. WHA is a great partner, and reach out to them. And because again, it's possible the health departments are still reacting to this pandemic, and some of them are able to respond quicker than others. And some of these questions are brand new. I can tell you right now, no one has asked us about bamboo until just this moment. And so all these things, we're all working together to figure this out and to get you open as quickly and safely as possible. So definitely, keep the questions coming, but keep those standards in mind and just make sure that what you're going to do is going to meet that standard.
Joe, my next question is not as the barriers as much, but the distance between guests. Where should people measure as they're setting up their tables over the next week? From what point to what point? Is it the corner of the table? Is it the back of the chair to the back of the next chair? What would you guide people to do as they're spending time setting up their dining rooms?
The point is to keep dining parties 6 feet away from other dining parties. And one way to look at it, and it's a difficult question to answer universally because obviously every restaurant is a little different from each other, but essentially you have to look at your space and you have to meet the capacity requirements, which would be important to make sure you're meeting those capacity requirements. And once you think you've got it set up for that, you have to make sure that each dining party is not going to, there's no one individual there that's going to be closer than 6 foot to an individual in another dining party. Generally speaking, that's chair to chair because that's where the customers are going to be. And I can't speak exactly for the back of the chair to back of the chair. It's going to depend on how you're set up. I can't, it could be middle of chair to the middle of the other chair. Back to back could work. It just depends on your table arrangement. The key is that when guests are seated, no one at the dining party A and dining party B are closer than 6 feet to each other.
Okay. Julie, do you have another one, or you want me to read off one I've got here?
Yeah, there were some questions about high-backed booths, so booths that are really tall. And I'm thinking about, just for reference, something like 13 Coins that has really tall booths. Is a physical barrier still needed there, or is there any further guidance you can give about about booth height?
I think that what we discussed earlier, I think is still would still go. I mean, if people can stand up and see over the booth to the other dining party, then you're probably going to need a little bit of a barrier to address that. But if they're so high, they're 8 feet tall booths or 7 feet tall, and someone could stand up and no, I have no idea if anyone's sitting next to me, then I think that would suffice. But I think most cases are probably going to need at least a little bit of something.
Okay, last question in this area. Then Sam, I'll see if there's any repeat question that you've got in the chat room on this one. I'll let you ask one, but some people have things like pool tables or foosball tables and video games 6 feet away from those from other games, or any guidance on what to do with those areas during this time.
So are you asking if Pac-Man and Asteroids should be 6 feet apart from each other? Is that what?
Well, I think that the question is, one, do tables have to be 6 feet away from the video game areas for a video game or a pool table? And then two, I guess then the video games themselves probably have to be distanced, I would guess, but I'll let you answer that.
Yeah, that actually have not thought of that. So I'm going to give you the unpopular answer first. I would recommend, because those are heavy touch points, and I'm giving you the unpopular answer first. I would recommend those aren't used in phase 2. I think it's going to be hard to keep people 6 feet apart. I think it's going to be hard to, on your staff, just to disinfect those, what we call touch points. You'll see that term a lot, touch points. And a pool table and a video game are, those are definitely touch points. You can't do it without having your hand all over the joystick or the pool cue. So I would, again, this is just a recommendation, and I haven't talked about this with Anthony or his team yet because we haven't had the question. But when we're talking about a high touch point like that, it's going to be really hard for you guys to keep up on keeping that disinfected, every hour, or even with that such frequent use. That's going to be tough. We might have to get back to you on that one, just because I haven't even thought about we've been focused on, literally the dining part of it and not the kind of the recreational part associated with the dining. So we're going to have to get back to you, but off the cuff, my recommendation is, for now, those are cordoned off and just blocked off for now, but we'll get back to you for sure on a more thought out question with the association.
Thank you for your honest answer. Sam, give us one highlight question from the chat room, and then we're going to get on to the next requirement.
One question that I don't think has been talked about here yet are employee screening. So, Joe, would you like to go into?
Sam, we're going to come up to that requirement here in a bit.
Okay.
So we'll save it for when it pops up.
Okay, another one would be a question on bar tops. We know that the guidance says no bar tops, but there have been questions about what if you put plexiglass around someone at a bar top? Is that allowed, not allowed?
Right now, from what we understand from the governor's requirement and answers to questions, is bar tops are not going to be open during phase 2. We are still working on some clarification issues on these requirements, but as of right this moment, I would plan for phase 2 to not have the bar tops with bar stool seating open right now. Is that similar to what you've gotten an answer from the governor's office, Sam?
Yeah.
Julia?
Yes.
Yeah. So it's better to think of it as a bar stool area and it's a counter than a bar.
I like that. I like that visual better. Yes.
Yeah. So for diners, I think it's where they may think, well, we're not a bar, but the fact the regulation was meant to say bar stool or bar area. Got it. Okay. I'm going to move on to the next requirement. That was the one we had the most questions on. And then the next one we had the most questions on is guest occupancy. The requirement is up there for people to read. The first question I've got clarity on is the fire capacity, the seating capacity is based on the fire marshal's listed capacity, and just confirming that. Joe, is that what you understand?
That's my understanding, yes.
Okay. Julia, do you have another one in this area?
Yeah, so the second question we're getting are customers waiting in the lobby and waiting area. Do they count against your capacity for service? And I suppose we also might want to if you've got any thoughts or best practices about the waiting area, might be a good opportunity to discuss that.
Yeah. So the first part of the question about, do they count against the 50% maximum? It's just going to depend on how I think that, the fire, I'm assuming yes. I mean, off the top of my head, I'm assuming yes, because that's part of your building. It's all continuous. And one of the intentions, keep in mind about this requirement is to minimize congregating of people and exposure. And so I would say that they would guest waiting inside. The weather's getting nicer, so maybe some people may wait, outside, and that's a business decision. That would not, I'm sure, count against the building occupancy. But what still needs to happen, though, is 6 feet separation between parties. I'm sure, the grocery stores have been practicing this for a while, where they have signs on the floor, tape. It will be a little bit difficult, I know, to keep parties 6 feet apart when they're waiting, and so I can't speak exactly to how you will do that. Like I said, tape, signs, those are the best ways, but they definitely, the groups have to be 6 feet apart while waiting, just like they have to be 6 feet apart while dining.
Okay.
And it's going to be a lot of, I think, customer education is going to be really important in letting them know. But again, a lot of people have had experience with this with the grocery stores, so it's nothing that's totally brand new anyway.
Great, thank you.
Joe, next question is on the outside capacity. This does allow for some flexibility with outdoor seating, but the health department I know is involved with that. If someone wants to utilize part of their parking lot or another area that is available to them for outdoor seating, how does that impact this requirement, and how do they work with their health department to make sure that's allowable?
I mean, that could bring into play other agencies, perhaps. Just to make sure there may be building issues. There may be requirements for you to have a certain number of parking spots based upon your building size. You got to keep those into consideration. The health department's not going to know all of those. I would also say that keep in mind that, again, the purpose of this is to minimize the number of people that are in a facility. You got to think about restrooms as well. And so the more people that you have at your food establishment and trying to use the restrooms is also going to create problems with congregating and being in close proximity to other people. So I mean, if you essentially triple the size of people that you can serve because you have outdoor seating, you got to think about how that's going to impact what other facilities they need to use on the inside of your restaurant. So keep those in mind. We haven't had that direct question either, so that's something that may be coming. Have to think about further. It definitely would not affect your 50% capacity inside. I can see that, and so that's true. But again, I think we have to be careful of the intent of this, which is to keep your customers and your staff safe. And the more people that you have, the more risk that you're going to have in general. So, and keep that in mind. Also, you also have to keep that in mind if you're going to try to, I guess we'll get to this question probably later, but if you're going to try to keep track of who's used your establishment for potential contact tracing later on, think about that too as you ponder how many people you want to allow when you first open in phase 2.
Okay. As people have questions, what I'd love for you to do is, as you see the requirement come up, type your questions in this area. Just make it easier on Sam to keep track of what should be asked here. And a lot of questions are coming in.
Anthony, I think before we move on from this question, we also might want to touch on if you have alcohol service and you're thinking about outdoor seating or extending that outdoor seating, you're going to need to think about how that impacts your liquor permit as well. And just so the folks on this webinar know, we're also working with the Liquor and Cannabis Board to set up a follow-up here to talk about how these rules are going to impact your liquor license and floor plan as well.
Okay. Julia, do you see any other questions on guest occupancy and the 50% and/or the outdoor seating?
Yeah, we do have some questions about how the guest count impacts events. And so this might be a good time to clarify that large events are not allowed in phase 2. There's still the 5 person gathering limit in phase 2. The questions are about, do guest counts include event attendees? Or does this count include staff, vendors, et cetera? And I think we want to be real careful on how we communicate events and event sizes. We're still at the 5 person limit. Anything else to add to that, Joe?
No, that's exactly right. We've had a lot of questions about events, and in phase 2, events are really not. You can just pretty much say events aren't allowed unless you can have a 5-person event, which would be really tough to pull off. So right now, we're just in the initial phases of getting it back into business, and so definitely follow that guidance. That events right now are pretty much not allowed.
Okay. Sam, we have time for one question from the chat room on occupancy and/or outdoor seating. Anything that's come up that you would like to ask here?
I think all of those questions have been addressed, but we have had a lot of questions on how to keep staff 6 feet apart. So I don't know if that's coming in another section, but I wanted to.
I think that will come up in the L&I section, Sam.
Yeah.
Thank you. Also, I know there's been some questions, and for those of you who missed the beginning of the webinar, there are 2 items we're not going to cover today. One is the liquor control board in the bar area. We are going to have a webinar hopefully very soon. We're working with the liquor control board to get that scheduled, and so we can get all the recommendations and insight from the liquor control board on how that's going to be handled. And we're still working with the governor's office on the customer registration issue. And so at this point today, we're going to wait till that further clarification comes out. And then we will have additional information shared at that time. So those 2 areas we're going to save so we can give you really solid answers when they come up. Next item up is single-use menus. And we have had a handful of questions on those. Julia, do you want to take one first and I'll take the next one?
Why don't you take the first one, Anthony? I don't see those questions here.
First question is, one member wants to be absolutely clear. So is there any way to do a washable menu in phase 2 that's left on the table?
As written right now under the governor's requirements, the answer is no. We have asked for clarification on that. Earlier guidance that was developed considered reusable menus and disinfecting them in between each dining group, but that was not in the final issued requirements. So we are asking for further clarification on that.
Okay.
Right. I'll add on to Joe's comment. We also suggested that menus be sanitized between each customer or single use. So we also offered that suggestion, and what we got back did not include that suggestion.
Second question is, do we have to use single-use menus, or can we use a rolling chalkboard or online or television screens or other things to project a menu, or is this now a requirement that we have to have single-use menus?
Those options are absolutely allowed from what I'm just going to make a decision on air here. We think so. We think yes. This is not a mandate to use paper menus. This is just to reduce touch points is the goal here. And so if there's other ways to do it, absolutely highly encourage other ways outside of paper menus. All the things that Anthony just mentioned, I could see would be perfectly feasible and allowed.
Okay. Well, I've already heard a ton of creativity, Joe, so I think we're going to see some really unique things, from Q codes to an old school chalkboard from when you were in school that they could roll by tables. So we're going to see some fun stuff to keep our customers healthy, I think.
Okay, yeah, you know what? I mean, there's some crazy requirements that we got to do, and this is a crazy pandemic. And if we can do something that's fun and creative, I go for it. It's going to just help everybody.
Sam, what do we see in the chat room on the menu issue? Any questions from our members on menus?
I think those questions have been answered.
All right. With that, I'm going to move on to the next item. This is about the lobbies and how to manage our lobbies. The requirement is up on the screen. And we talked about this a little bit earlier. But Joe, I think it's a good time to reiterate what you said before. When people are trying to keep their lobbies safe, what is the health department going to be looking for? And what would you recommend they keep in mind?
I mean, again, as we talked about, little creativity, whatever you can come up with to make sure that the customers are staying 6 feet apart from one another. It could be a sign, which it could be tape, it could be things on the floor, it could be rope and different things, whatever ways you can do it to make sure that customers are 6 feet apart while waiting for payment. We recommend if you can do payment at the table, that's one less line you have to worry about. So that would be helpful as well. And then also, there's a highlighted part here, implemented a plan. And that's, I think, one of the key messages that I want to leave today is that you really think about it. And obviously, there's over 400 of you on this call, on this webinar, so you are thinking ahead. But may have a plan and make sure that you have thought about all these things and use the tools that WHA and we're going to provide you to help you think about this and think it through and actually be ready to open when your county moves into phase 2. So this is part of that plan: is how will I make sure that how I make sure my customers are 6 feet apart from one another.
And I would echo that, Joe. I think this is an area where I do worry about our risk, and we've been entrusted to get open in phase 2. That was a large conversation about should we be in phase 3 or phase 2. And one of the areas I think that's on us to do well is our lobbies. I mean, all of it, but I think these are where we see people congregate and wait. So we are, as an association, are going to try to get out many of your ideas. If you have a creative idea where you can share, get that to our comm team so we can put that up. But we're hearing everything from having people to wait in their cars to having the areas to stand in your lobby to like lines you've seen outside grocery stores that control entry points. So please be creative and think this one through. I think this is an area where we are at risk, and we need to do a good job. Sam, has anything come in the or Juliet, any questions?
Yeah, I think this is an area that might folks might benefit from a little background on this. I think initially we saw a requirement for reservations, so we could only serve guests if they had a reservation. Then the intent behind that was making sure that staff and employees can prepare for and have an expectation of how many guests they're going to have and can plan for how folks are going to enter the building and exit the building, et cetera. But we know that there's a lot of members who just simply aren't set up to take reservations. They don't have a reservation system. So the suggestion was, why don't you let us figure out how we're going to control the flow in and out of our lobby. So I think this is a really critical thing we spend some time thinking about. Each location is different. So each plan is going to have to take into account how folks enter and exit the building and when we're going to let them know their table's ready.
Yep. And reservations might be one of the things you choose, but then it would be your choice. Mm-hmm. But reservations are also a great way to try to push out the wings. Everyone wants to be in our businesses between 5:30 and 6:30. Love to see more people in at 5 and still dining at 7. Sam, what has come in from the chat room? Any questions related to the lobby plan or clarifications that would be good to ask Joe while we have him here?
I think one question that I saw, which was great, was regarding the plan and if it needed to be written or submitted. And so I think that does an overarching ask of a lot of things, but Joe could probably answer that.
I can answer part of that. There's Elle and I will also talk about a plan, I'm guessing, during their time. For these, written is nice, and that's good for you. But in our conversations with the health departments, they're not going to be coming around and looking for written plans. They're going to be asking you questions and making sure that you have a plan, and that could be verbally described. That could be described via an email if they do an email inspection. As you will find out, inspections are being done a little bit differently too from the health department perspective. So written is always nice. It's a good record to have for you. But if you don't do a written one, then just make sure that you've thought it through and can answer questions and can demonstrate your plan too when you're actually open. We will have, and on that too, we will have a checklist that we will want you to complete, and how a health department uses that will vary. Most of them may ask for that at some future point, but really want you to have that checklist just so you can show that, yep, I went through, and that'll be paper or filled out electronically. It's up to you, but you'll have a checklist to go through to just make sure, yes, I thought of that, I did this, and so that'll be an important part of the reopening.
Okay, Sam, any other questions in this area? All right. If we are not a table service restaurant, if we, in fact, people order at the counter, how does that impact social distancing and some of these rules we've talked about, Joe?
Yeah, the social distancing standard stays the same. So each business model is going to have to be a little, different in how they implement it. But the whole guidance, the whole requirement is the same. You have to have patrons 6 feet apart. So if they're ordering at the counter, they have to be 6 feet apart while they're ordering. And again, that does provide challenges, obviously, especially depending on how your facility is constructed and set up. But none of that changes. The business model doesn't change the fact that individuals, dining groups, have to be 6 feet apart.
Right, and I think I can add some additional background here too as well. In talking about what does table service mean, we're ultimately talking about are you eating and consuming the beverages on site? So if you offer that, right, if you offer a dine-in option, that's what is being discussed here. If folks are just simply coming in to place an order and wait for that order to be completed and pick it up and go, there still needs to be a social distancing plan in place. Versus the dining room, you're going to need to think, if you've got fixed tables and booths, you're going to need to think about how you would make sure folks can't sit at those tables if they're less than 6 feet apart.
Great clarification. Julia, have you got any questions? Julia, do we have any questions from the members who were pre-submitted in this area?
Yeah, and I just want to put an additional point, Anthony, you've mentioned this a couple of times. There's a lot of questions that interact with this one and then also the customer log, sort of what is meant by that. And I want to again reiterate, there's been a significant and overwhelming volume of questions on this topic. And we are not done with that point. We're still working with the governor's office on what that looks like. There's still a very robust conversation happening. That is not final guidance, and we're still working on that. So the message, the resounding message has been heard, and the governor's considering that, and we're still working there. I just wanted to make that absolutely crystal clear because there's a lot of questions on that topic.
Okay. Sam, anything from the chat room about how quick service restaurants or limited service that don't have table service that you feel haven't been clarified yet?
Someone just asked a great question about self-service drink machines that you'll see in quick service, and if those are still, and how an operator should handle that.
We're asking for clarification on that because we want to make sure that we fully understand what the requirement. The requirement uses the word, and I can't quote it exactly, it's not in front of me, but self-service food bars. Would that include drink stations? And so we're asking for that clarification because we're not sure. We know that we have seen some guidance from other states where they allow the lever activated ones, but not the push button ones. And what we don't have, unfortunately, I don't know that for sure because it's not clear to us what a self-service food bar is, what the intent of that phrase is by the governor's office. And I don't know if WHA, if you've asked that question or not, but we have that question that we've submitted.
Yep, we're still working through that, Joe. It's a good and important question we got to get clarification on.
I would say, even if there's not a requirement on it, I think for operators to plan for 6 feet distancing, certainly we've seen people crowd around pop machines and think about how you mark the floor or otherwise so we get more guidance in this area. Sam, is there anything else in this area? All right, we're going to move on to the next one. These are a little bit harder to read, but we felt these were pretty straightforward. And these are the remainder of the health department area requirements. Heck, I'm going to have to put on my glasses to see that. But these are simply like having sanitizer at the front of the building. We felt that was pretty straightforward. All parties and guests must be, or all parties and tables must be 5 guests or less. Joe, one thing we have had some questions on is the strongly encourage or suggest customers wear a cloth face mask anytime they're not seated at a table. This is not a requirement. But some people have asked, can we require it for people to come in our building? Can we say to keep our employees safe and have the business make the choice to require it?
Yeah. I mean, there's no reason why you can't make that business decision. Other businesses that are currently open have made that decision. And so if your business wants to do that, then absolutely. But it's not mandated. It is strongly suggested, and it certainly would help during this pandemic, but it's not required for customers. And I'm sure you'll talk about that regarding employees in the next section.
Yep, I think we will. Sam, here are kind of the remaining health department requirements that came out from the governor's office. We felt most of these were straightforward. Were there any questions that came through in the chat room that we could take a minute to clarify here while we have Joe on board?
Yeah, there was a great question. If a family comes in and they're a family of 6, does that family have to then sit at 2 tables? And then another question that has been asked is, are restaurateurs and staff in charge of enforcing these guidelines of social distancing and not talking to their friends? Because this operator works and lives in a small community where everyone knows one another.
Well, I can tackle the first one. And the first one is a question I think that we had, for a while now when we just were even discussing these requirements. From a health perspective, that, that family is living together. They can certainly dine together in public. However, the letter of the requirement says 5 guests or less. And I think, really need clarification on this one. And I'm not sure, WHA, Julia, if you've asked that question or not. I know Sam and I had conversations about that a long time ago. But this is what came out, was 5 guests or less.
Yeah. Yes. And at this point, what we understand is the 5 guests is very solid, right? It's just 5, period. Even if you're a family of 6, you would have to make sure that there's no more than 5 people at a table.
Okay. And then what was the second part of the question? Sorry about that. Oh, I'm sorry about friends and friends and family.
If guests are like walking in to their table and they see neighbors of theirs and they stop to say hi, our restaurants required to be the requirement, the hammer on moving guests along.
I'm going to just go out on a limb and say no. I don't think that's appropriate. I mean, I think again, there's a lot of education that needs to happen, and so you just have to educate. And I think that if it was to become the point where everybody's moving tables around and they're all trying to sit next to each other, and you have parties of 12 people instead of 5, I think it's a different conversation. But just someone stopping by and saying hi, it's happening now in places that are currently open. And I just don't think that you want to get to the point where you're trying to police that like that. But emphasizing education and making that point. Maybe, again, I know we're not popular. It's not popular to have signs, but just somehow to remind customers that, please respect social distancing requirements during this, time or whatever. But as far as actually you putting the hammer down, I would recommend against that.
Okay. One question I got here, Joe, is on buffets and salad bars. If you have a buffet or salad bar, can an employee go and fill that up on behalf of the guest and bring it back?
We are asking that question as well, because an initial draft of the document allowed employees to do that. And this one, there's just a lot of discussion back and forth. And I think in an interest of time to get this out, that right now they're not permitted. That's why there's this part about addressing through subsequent interpretive guidance. So we've asked about, when and who will issue the subsequent interpretive guidance. But I would say that style of service meets the intent of this. If you actually stocked a salad bar, but it was not open to customers, it was clearly not open to customers, but a food employee was serving up salads from that, I don't see any reason why not. Social distancing is being met. It's a touch point that's going to be disinfected like every other touch point. It just happens to be a touch point by the employee. I would think that would be fine. I think the intent of this is for self-service. we are going to have to get a little more clarification for sure on this. But I would think, again, as long as it's clearly, if you have customers that are confused and going up there and serving themselves, then I'd say shut it down. But if it's clearly where the employee is the only one doing it, then I don't see why that would be against these requirements.
Okay.
Yeah,
Thank you,
I just
Joe.
want to agree completely with what Joe said. There was a lot of conversation around salad bars and buffets, and I think a lot of a level of discomfort around how that would work. And the conversation was getting rather complicated around salad bars and buffets. And so in an effort to not hold up the rest of the guidelines, made a commitment that we would continue to have the conversation about salad bars and buffets.
Okay. Julia, would that include dim sum carts as well?
We did not have a specific conversation around that. I wonder if that's something Joe might have.
I mean, you know, just again, off the cuff, these are questions that, you know, we are seeking answers to. This is pretty much brand new requirements. But if an employee is taking that around and serving the food, I don't see that as being a problem, but we should ask for clarification from the governor's office. But again, it's not self-service, and that was I think to me, the conversation that was had was about self-service and those issues. But if it's an employee in complete control of that food, that to me seems to be the point where you're limiting the amount of people touching a surface, and then also limiting. I mean, you know, you want to keep it away from. Well, actually, it doesn't matter. I mean. It's not foodborne, so coughing and sneezing on food isn't as much a requirement. But it's much more the congregating at the bars, as well as the touch points was the concern of the self-service. So if it's an individual cart going around, I don't see an issue with that. But we should get clarification, and that's something probably we should explain somewhere in guidance to make that clear.
Sam, any other questions on the health department area before we move on to Pam with L&I?
One more question was from the quick service sides. If you have a grab and go section, is that still allowed? And whether or not they should discontinue
that? A grab and go. Let me look. I'm looking at this. Buffets and salad bars are not permitted. Grab and go. I would say that the key to any of those is that social distancing is still happening. I mean, you know, that you're making sure that people are 6 feet apart. And that any touch points that are involved with that grab and go need to be disinfected at the same frequency as all of the touch points. And so keep that in mind in your plan as you start thinking about a kind of a sanitation plan. What are customers touching? But I would think that still meets. I still think that would be okay with social distancing and a sanitation plan, because again, the intent of that is for customers to walk up, look at something, maybe make a quick decision and grab it and go. I would think that meets the intent. We will, I think, if I can see Julia's small picture, she might be taking notes, or someone's taking notes about that question. But it seems to meet the intent of, as long as social distancing and sanitation are met, then it should be fine.
Great.
Okay. Sam, any others? Or can we go ahead and move on? Joe, as always, you're a great partner to work with. We've worked on food codes together, clarifications, foodborne outbreaks. And it's always good to know that we have a wide open door with the state health department, and we can figure these things out together. So you're welcome to listen to the remainder of the webinar, and in case there's any questions at the end. Are you going to be able to hang with us, or do you need to get
Yeah, I'm going to go ahead and hang with you, because I think we're having a short Q&A session at the end. Is that right?
Time permitting, I think that would be great.
Okay, I'll go ahead and close my video. I'll keep, and probably my audio too, but if needed, I'll be here and I'll be listening. And if I need to pop back on, I'll be able to do that.
Okay. With that, we introduced Pam in the beginning. Pam, welcome.
Hi.
Thanks for the partnership with Department of Labor and Industries and being here today. Going to follow the same format. We're going to bring up the requirements that have gotten the most questions first, to make sure we try to get as many of those answered. And then we'll kind of go from the law of diminishing returns of the ones that have had the most interest from members so far. With that, we're going to start with the 6-foot distinction between employees, which is up on the screen now. Julia, do you want to lead us off with a couple of the questions about this requirement?
Sure. So how are operators supposed to handle the pathway for people to go? I'm thinking hallway to restrooms, or when they're just sort of passing each other. How should we handle interaction like that?
So I'm going to give you guys a kind of a big general on social distancing. So it is a requirement to social distance. How you're going to do that really is going to be based on your layout at your restaurant, how you can make sure that people, employees, including to the owners and everybody, to be social distance by 6 feet. That includes the cooks and all staff. So and there's a lot of questions in this area, so I just wanted to put on the table right away that it is the social distancing by 6 foot is a requirement. So how you do that depends on how you can set up your business. One of the things, there's a question about, if cooking staff, they're in a small enclosed area, what can they do? You're going to probably have to stagger your guys' work schedules. You're probably going to have to put breaks at different times. When you have a narrow hallway, you probably would want to have some way to monitor that so that when someone needs to go down that hallway, there's somebody else not coming through that hallway. So like it's the bathroom, if you're putting up a sign saying one customer at a time, but you'll kind of have to figure out, you'll have to be creative to figure out how to do some of this stuff, but that's, but the main requirement being that you have to social distance by 6 feet from L&I. That's what we'd be looking at if we came into your establishment.
So for and just following up on that, when there's two people walking past each other, and if they both have protective equipment, like if two servers are walking past each other and they have masks on, et cetera, is that okay if they're not, in the same 6 foot bubble for a duration longer than a second or two as they pass? Is that type of scenario okay or safe for employees?
So I would say in phase 2, no. You're going to try to figure out how not to do that. If it happens because it just is an accidental thing, I mean, that could happen, but really try to figure out how you can, mitigate that. And so, what would be a thing we wouldn't want to see is, well, I say, yeah, every once in a while that's okay. And then we decide, employers decide that, well, there's all these situations that we have to do that in. Instead, think about how can you mitigate those close contact times. Just at least through phase 2, once we get through the phases, we're kind of going to go back to normal and you don't have to worry about all this. But for right now, if you're opening, you're going to try to figure out how to social distance by that 6 foot and not, figure out how, you're going to have this closer contact at times. You just don't want to do that for now.
So Pam, help us understand a little bit, or maybe this is something we can clarify further as we go. And working with the governor's office, that was where feasible. And where it's not feasible, we simply need to have barriers or masks. So my own brain's having a hard time balancing the feasibility of you have to walk by people sometimes. And in a kitchen to get from one end to the other, you have to walk by people sometimes. That's where we felt that the feasibility gave people some rational options to move around. Is that a fair statement?
Yeah, it's a fair statement. The question about feasibility is going to be really based on, what all you've done to mitigate it. So, let's say that, for some reason, L&I is coming into your establishment and you have you tell us it wasn't feasible, but then we're going to take a look at your, how you staggered your work staff and it could have been, then, that would be something we would probably be looking at. So, it really is case by case, and there isn't one great answer. That's the thing here is it is more of, can you figure out how to do the social distancing by 6 foot? And if it's really just not feasible, maybe you don't have so many employees working at the time, or you try to figure out a different way to do the 6 foot. There are going to be situations where maybe it's not feasible, but that is when we do rely back onto the PPE and we do the hand washing, and that's why your safety plan for the COVID-19 is going to be very important. Is how are you going to deal with those points where you just can't social distance. But I just want to remind everybody, try to think about any kind of way to social distance by the 6 foot. So. Hopefully that answers the question.
So Julia, how would you summarize that before we move on to the next thing? You've heard kind of a conversation between feasibility and doing the best you can to keep people away. Could you give us your own interpretation from working in the governor's office and the agency of how would you summarize the conversation that Pam and I just had?
Sure. So at all times, employees need to be 6 feet apart. So operators need to make every and all effort to ensure that customers and employees are 6 feet apart. When that is not feasible, and L&I is really going to be looking at a number of things. Did you look at staggering work hours? Did you look at any other option to keep folks 6 feet apart? And if it's still not feasible, then employees need to have the personal protective equipment.
Okay, thank you. Pam, I'm just going to ask you a favor. I hate to give your click button an active thing, but we're getting a little bit of feedback.
Okay.
So if you can, in between the conversations, if you can mute, then I think our participants might be able to hear you better. Julia, are there other areas in the 6 foot that we haven't answered yet with that dialogue? And if not, I'll kick it over to Sam for any questions in the chat room.
So I think I'm skimming through here, and I feel like we've covered this in length. I think there may still be questions about when delivering food to customers. So obviously, you're going to do that as far away as you can, but there will at some point be a break where you're less than 6 feet away from customers. So in that scenario, what type of personal protective equipment is needed?
And this will be the type of equipment we're expecting pretty much everybody to really be wearing. So it's the some type of face mask, likely the cloth face mask, which everybody can more likely be able to attain, but the surgical face mask would also work. And then the type of gloves they might need.
Okay. I'm going to go, Lex, I'm going to go back one screen. So Sam, we're going to come back to some PPE questions, but was there anything else on the 6 foot and the feasibility of keeping our employees safe?
Yeah, I think that the questions were answered. There's still just a lot of confusion in the back of house how you actually do the 6 foot distancing. But again, what I heard was you try your hardest, and if not, try to stagger shifts and schedule. And if that doesn't work because you have a small space, you really need to ensure that your employees have personal protective equipment. So I think it's been answered. We'll probably continue to get questions on that, but I think I've heard clearly.
Thank you. So with that, I'm going to move on to the PPE, which, by the way, I've been using more acronyms, I think, in the past 4 weeks than I've ever used in my life. PPP, PPE, EISL, I don't know, IDK. So with that, Julia, what are some of the questions that have come in ahead of time on PPE that would be a great time to ask Pam for some clarifications?
Sure. So the question is, do employees have to wear masks at all times? And do the employees does the employer have to provide the mask for employees if needed?
It's kind of, I think it's difficult to answer the question about all times. Anytime you're out in public right now, that's what we're expecting. We're expecting you to wear it at your job. So there really isn't like sometime you're taking it off there. So I guess that's yes. And it is required. So you need to wear the cloth face mask, or you can wear a surgical mask. You cannot wear face shields. They're not something that is considered protective enough. So hopefully that's the answer to that question.
Mm-hmm. Yeah, so when we talk about a cloth face covering, there's been a lot of questions about, the surgical masks or paper masks, and I haven't personally seen a paper mask, so I don't know if Anthony or Samantha has additional descriptions there. But what type of facial covering is appropriate from the LNI's perspective?
Really, we're kind of okay with anything you can find. You can wrap a shirt around your face. But the surgical masks are usually the paper masks that people think about. Also, there's kind of dust masks. Those would be hard to find. It's really actually hard to find surgical masks. Well, it was a week ago. I don't know. I think everything's changing. So, but anything that you can use to cover your nose and your mouth is considered a face mask to us.
Thank you.
Joe, I don't know if you're still with us from the health department perspective, but the health department and the industry have been working for years together on the question of gloves. And there's always a debate on hand washing and gloves. Typically, hand washing is better protection. What is your guidance for the front of the house and gloves, Joe? If you're still with us,
Yeah, I'm still here.
And should gloves be worn in the front of the house?
Okay, so I'm going to answer. Pam and I spoke about this earlier today, actually, because I know there's a little differing guidance out there. From the food safety perspective is where we're coming from, and then gloves, disposable single-use gloves, are required to keep bare hands off of ready-to-eat foods. So that's the book answer, and that's the purpose of gloves in the food rule. There are some employee protection that has been added for the phases that we're in right now with this pandemic, and that is from the employee safety standpoint, and those are L&I requirements. And so I will let Pam speak a little bit more on that. But again, from our perspective, we're looking at food workers, making sure they protect the ready-to-eat food from germs on the hands, and that's when a single-use glove or utensil. Again, we're not a big proponent of all gloves from our perspective, and we're not a proponent of gloves for taking out the garbage, for washing dishes. Those can be like, the kind of the Playtex kind of gloves, the non-disposable ones. But we want to reduce waste is one of the goals too, in addition to protecting the food. But that being said, there are some employee protection needs during a pandemic that differ, and so Pam can speak to that. Kind of the phase 2 and maybe future phase requirements on gloves for front of the house employees. She can speak to that a little bit more.
Pam?
Okay. So we did talk earlier, Joe. My opinions changed since then. We're not expecting, really, we're thinking about restaurants being kind of low risk when it comes to contact COVID-19. So you're not required to wear gloves unless you're doing the food handling. What you are required, though, is to have a plan in place on how you're going to wash your hands. And so a lot of, there is a safety plan you're going to be putting in place for the COVID-19 to go along with your accident prevention program. And in part of that, you're going to need to you're going to need to figure out how you're going to have your employees washing their hands after they have contact with the dishes and that kind of thing. So really, it's not, we're not going to require you to wear gloves, but we are going to have you have a way to continually be washing your hands after you touch surfaces.
So if I can summarize what I heard the two of you say, at the end of the day, we want to protect our employees and we want to protect our guests. And so between really active hand washing and gloves, pick the path that's going to most protect your employees and your guests in the front of the house. Is that a fair summary of those two conversations at this point in time?
Yes, I say so.
Okay.
So Anthony, I think adding on to that, when an employee is taking payment or a credit card or handing someone a pen to sign their bill, they don't need to be wearing gloves, but they would need to be washing their hands after each sort of touch or interaction there. So it would be up to the establishment and the employee to decide what would be more effective, washing hands in between each of that or switching gloves. Is that
the thing with gloves, the thing with gloves, and Joe would talk about this also, is that they can just be as contaminated as your hands. So the most effective practice is after you're done with a customer or a table or however you guys think about it, once you're completely done with that, then you're going to wash your hands before you do your next interaction. That's how I would do it. You can have where, there could be some hand sanitizer in between like when you're dealing with one table and you brought the pin out and you had to go get something else, you came back and you just going to do a hand sanitizer, you could do that. But after the whole process, before you were to move to the next customer or the next event or a thing you're going to do, you'd want to have them wash their hands. So there's a lot of hand washing going to be happening.
We're used to that.
Coming back to something that Julia said earlier, small restaurants in particular, cooks will often be by themselves in the back of a kitchen with a pass-through window, separated from other folks, and it does tend to be hot in the kitchen. If a cook is isolated in the kitchen with a pass-through window, are they okay to not be wearing a mask in that area?
You know, I'm not sure. I would say, you know, to err on the side of caution, you'd want them to wear those masks, even though it gets hot in there. But I can come back to you with a more clear answer.
Thank you, Pam. Sam, what else has come up in the chat room that around PPE that people would like to know about?
Yeah, I think just to tag team onto your question, Anthony, there's been a lot of chat about concerns for cooks who are working over the grill and it being very hot to wear the mask and how employee safety falls into that. So extra feedback on that would be fantastic. And I think one of the things that's come up is the difference between a face mask and a face shield. What is the difference and why is a face shield not allowed and a mask is?
Well, the first question, so the social distancing, the cloth coverings and phase 2 are required. So if it is hot, you're going to need to just, maybe you're turning up air conditioning or you're putting a fan there, but there's no really way around the cloth face mask. They need to wear that. If they're by themselves, then, you know, and they're really not going to have contact with anybody, then, you know, you could maybe think about that a little differently. But I don't know what scenario anybody would ever be completely alone in a restaurant. So it's likely that you're going to have to wear these cloth face masks until we're in a different phase, even though it's hot. So you just have to kind of, you know, speak to employees about that scenario and, you know, try to best make them comfortable. The face shields don't work because there is too much of the ability for the aerosol of COVID-19 to get into your face as well as it's for you to pass it to the other person. So it doesn't actually block your breathing, and that's the whole point of the cloth face mask. So that is the difference between the two.
Okay. Sam, what else is in the chat room there?
I think another question is around clarification. Is the employee supposed to bring their PPE equipment or is the employer required to give that?
The employer is completely required to provide all the PPE. So employees do not bring their own. They don't buy it. It is all up to the employer, and that's a requirement for all personal protective equipment from now on.
A follow-up on that one. Some employees have wanted to wear gaiters or other face things that are their own. If an employer is supplying it, but an employee wants to bring their own, is that still okay?
You know, I'll tell you how Illinois is doing that. We're allowing employees to wear their own if they want, but we're also supplying it. So we're doing both. This way, you know that you've given that employee all the required PPE that you feel is appropriate for them. And if they do want to wear something different, you know, and you're okay with it, that you can allow that. But you know, it's kind of the requirement really is for the employer to provide it. So it's not a hard and fast rule on that one right there, other than you've got to provide it. So if they want to wear it.
We thought we'd never live in a world with designer face masks. Just tell me the time we're in that we've seen battery-powered face masks and college logoed face masks and Rolling Stone face masks. It's just, and I know people are actually taking pride in their face masks, which is, I never thought I'd live in this world, Pam. I can't even begin to explain it.
Well, yeah, you know, another part of that also real quick is that, you know, you don't, if you say they can wear whatever they want, you know, you're going to have to talk to them about, you know, not wearing something inappropriate too. So
yeah, that's probably fair. Sam, what else have we seen in the chat room that would be good to help our members clarify?
How are these new regulations going to be enforced through LNI?
Well, so it's pretty serious, and so everybody needs to, when I say this, there's kind of two ways that we look at this. If we get an employee complaint that you as an employer are not following the COVID-19 guidelines, we will come out to your establishments in an enforcement capacity. Right away, we're going to ask you to, see if you, change whatever the issue is, and we'll help you try to fix it. However, there is a scenario that if you're not willing to fix it or it can't be fixed, we'll probably close your business until you can fix it. So that's kind of how the phases work.
Okay. Any other PPE questions, Sam? And if not, I'm going to jump on to screening employees. Okay. Screening employees is generally speaking, restaurants for years have not allowed sick employees to come into work to protect our guests. So the idea of making sure your employees are healthy is there, but screening is new. Julia, what questions have come in from our members on screening employees that Pam can help us with?
So there's a lot of questions on whether or not employers need to take the temperature of employees. Can you provide further guidance if that is a requirement?
Pam, you're on mute.
One of these days, I'm going to get all this technology. It's not a requirement to take a temperature. It's good practice. You can also just ask them how they feel. You can do questionnaires, that kind of thing. Really, you're just trying to get a sense of whether or not they're feeling well that day. Most employers that we've been dealing with in phase one did start taking temperatures. They thought that was easier for them than just trying to get the employee to tell them whether or not they were feeling how they felt. Most employees, especially people, everyone wants to go back to work, they might tell you that everything's fine. So I recommend taking the temperature, but you can also just ask or do a questionnaire.
Thank you. That's really helpful. So you've seen some employers doing like a checklist, asking an employee just to kind of go through a self checklist and identify if they have any symptoms, and that would comply with the requirement.
Yes.
Great. Thank you.
Okay. Sam, any questions from the chat room on employee screening for science?
One question just came in about how do I handle an employee that calls out sick? Will they need to be required to take a COVID test before returning to work, or will a doctor's note suffice? So just around employees being sick and how to ensure that they're safe to come back.
And this really isn't necessarily LNI, and I don't know if it's Department of Health either. These are kind of new things that we're all thinking about. What I would suggest you do is if that, you do have somebody go out sick, I would ask them to at least verify tell you they went to the doctor, or get the doctor's note if you can. Because if, the problem will be, and like DOH might be able to answer this, if you do have a case of COVID-19, you're going to, once that person's identified, it's likely, you're going to have to close, and they're going to have to do the deep cleaning, and you're going to have to monitor all your employees and everybody that had been in contact with that person. So I don't know if you even need the doctor's note, because they're probably going to take that test, and your whole life will be very different if you guys have somebody with COVID-19. I don't know, Joe, do you have any better answer for that?
Yeah, I mean, we have a decision tree, which we're still actually, in the CDC guidance, it's comes from CDC and through the Department of Health, and it does change a little bit. We're actually updating it, but in general, if an employee calls out sick, if they don't have any symptoms of COVID-19, it's just a call out sick for something different than COVID-19, then you treat it like any other call out. If, however, they have symptoms which include, fever, coughing, shortness of breath, loss of taste and smell, those symptoms are online, then you would ask them, well, have you been in contact with anybody that's positive with COVID-19? And the answer to that, yes or no, determines how long they stay away. Right now, the guidance is if they are not a close contact with someone known to have COVID-19, they stay home until they have been symptom-free for 72 hours. I mean, it depends a little bit on the symptoms also, but generally speaking, fever is what we're really looking at, especially. They need to stay home for 72 hours after the fever. That guidance might change, and so if it does, we'll update our decision tree that we have online. If, however, they have been a close contact, oh yeah, my best friend or my significant other, whomever, they've been in close contact with someone with COVID-19, they have to stay home for at least 7 days total. And also, if they had a fever for those 7 days, they'd be up to 72 hours past that time the fever went away. So it's a little bit confusing. That's why we have a decision tree. And really, it comes down to the symptoms, I think, is a key to keep in mind here as part of it. And so it's COVID-19 symptoms. There is lots of guidance online to walk you through those scenarios.
Joe,
So
is it possible for you to paste the link to that decision tree in the chat room? Or if not, could you forward that to Julia so we can get that out to our members?
I can paste it now, but like I said, I'm going to put a caveat in there that it is going to change slightly. And so never hesitate, again, to reach out to your local health department or a healthcare provider when you have the questions like this, and to make sure that you're following the latest guidance. But I will send what we have in the chat room right now.
Thank you, Joe. Okay, I want to go back to any other screening employee questions, Sam?
Yeah, there was a good question around what L&I's recommendation would be on how long to keep the employee log. So if you're having employees certify that at every shift they are, in fact, symptom-free, how long should an employer keep that record?
We don't really have a requirement. I would suggest you keep it probably till we get to phase 4. I just keep it. I mean, I don't think shouldn't be a burden to keep the records, but I don't really have I could try to find out if we're coming up with the answer, and if so, I'll give it to you. But right now, I don't have a requirement for how long.
Joe, do you have any thoughts from the health department side?
Yeah, a little bit. Yeah, I mean, it's a little bit. Don't forget, like Anthony mentioned earlier, the industry has always been focused on keeping their employees and customers safe, and so this conversation about illness shouldn't really be anything new. And before we were talking about illnesses such as diarrhea, vomiting, sore throat with fever, jaundice, those types of things. Now we've kind of added to that because of the pandemic. And not everyone keeps records. I think a log is a really nice way to do it. It makes it simple and everybody is clear, but you don't have to do that. But if you choose to, I'm just going to throw out a number here that might, because of such a long incubation period. And so if you're keeping that log for any kind of employee illness, including COVID-19 or the other foodborne diseases, I'm going to throw out 90 days.
Julia, any other insight from your conversations with the governor's office?
I don't have anything to add.
Okay. I would think Joe or Pam, at least 15, right? Because of the incubation period and the time frame. So I think
specific to COVID. Yeah, specific to COVID-19, I'd say 15 days. But again, if you're taking the time to have a log about COVID-19 symptoms, you should go ahead and add in the other ones too, because we want to avoid foodborne disease as well. And then I'd say 90 days because of hepatitis A.
Okay. Sam, any other questions in the screening employee area? We have time for one more, and then we'll move on to the other areas.
It looks like there are a lot of comments of not being able to hear us, so I hope that hopefully it was just a little bit of a glitch. One thing that did come up was that, Pam, you had said that if anyone has become ill or is exposed to COVID, a restaurant would have to shut down. But CDC guidance may say something a little different. So maybe just some clarification around that.
Unmute. I can't hear. She has to unmute. I think you're muted, Pam.
I am. I also think that's a Department of Health question. You're going to have to close down for some point in time if you do have something positive to clean your restaurant. You got to do a deep clean. That is part of the guidelines. So how long No, I'm not sure.
Joe?
Can you repeat the question, please? I was typing, sorry.
Joe, so one of the questions was around if someone is ill with COVID or exposed to COVID. Pam mentioned that a restaurant would need to close, but the CDC has different guidelines, which include, separating where that employee was working, sanitize that area, and so just clarification on what the state is recommending.
I am looking real quick right now. I'm going to do the same thing on that question and get you another link just to make sure that we have the latest information, because unfortunately it does change slightly over time. So I'll include another link in the chat on that. And then Julia, make sure, you see that and you can use those links in other places as well. And this will also be linked, at least the checklist I know is going to be linked. And sorry, not the checklist. The decision tree I mentioned will be linked in the checklist. So you'll be able to see that link on the location as well. But I'll send you the link in the chat because again, it's a little bit complicated and it does change. So to make sure you have the latest.
Okay, I want to move on. We're going to try to keep ourselves to about 45 minutes if possible. We also want to answer as many of your questions. Educate workers in the language they best understand about coronavirus and how to prevent transmission and employers' COVID policies. I do believe the association is going to work with the governor's office and the health department to make something simple. Doesn't mean you can't do your own. But Joe, I'd love to work with your agencies or some others and actually just do a little YouTube video or something that we can make simple for folks to watch and educate, but and Elle and I as well. So we're going to do our best on that area to get that out there and make it available in as many languages as our technology will help figure out. With that, Julia, is there any other questions that have come from our members on this requirement?
No, to just think a general question about how to access different languages to get that training out to employees.
Okay. Pam, can you mute in between here? Sam, is there any other questions from the chat room on the education requirement?
No.
Okay. I'm going to move on to the next one. Establish a housekeeping schedule. And this really gets back to touch points. I think I'm actually less concerned about the tables as I am of lobbies and door handles and bathroom handles. These are the areas where we have to be really strong on. And I do know from a restaurant perspective, we all know how important it is to clean between every use. Julia, we had any questions from our members about touch points and housekeeping schedules and cleaning?
I have not seen any. Sam, have you seen any come through the chat?
I think there's just been some clarification on whether you can still use credit card payments and things like that. But other than that, it's been pretty quiet on that topic.
And I do believe we heard earlier from, I think it was Joe and Pam, that if you take a credit card or you take something someone else's, you're going to have to wash your hands and sanitize in between. So, Pam, is that an accurate statement?
Yeah, that's what we were recommend.
Okay. Julia?
Sorry, it broke up there for a brief moment, so I couldn't understand what you were saying.
Oh, gosh, sorry about that. Just that we can keep taking credit cards. We can't have pens, but the important thing is after each use, hand washing always, folks. We're being trusted to open here in phase 2 and sanitize the things that you can in between use.
Right. And I think one of the reasons we were able to demonstrate that we were ready to open and serve in phase 2 is because this comes so natural to our industry, right? We're used to sanitizing and cleaning. We've already got those strict standards with our food permit and through the Department of Health. So I think this one is fairly straightforward.
Okay. Sam, anything else in the chat room before I move on to the next one?
One just came in around tablecloths. Should they use cloth tablecloths or move to vinyl wipe downs?
Good question.
And then for L&I or DOH?
I think that's a Joe question. Joe, for the industry that has tablecloths, how would we approach those given the pandemic?
Okay, another new question. Thank you. I'm going to say, because every table setting after every dining group needs to be completely refreshed, the tablecloths would have to be removed and laundered in between each dining party, because they could be contaminated. It's a touch point for sure. That's, again, the first time I had the question. That's the answer off the cuff. I'd love to hear WHA input, but I'm pretty sure that when we say all the table set, the complete table needs to be broken down and cleaned and disinfected, that would include the tablecloth as well. Any other thoughts?
Julie, any different guidance from your conversations?
No.
All right. Any other housekeeping or touch point question, Sam, before I move on to the next one? All right. These are the things we've not got as many questions on.
Anthony, it does look like we may have given the impression that folks can't pay with cash, or that customers can't pay with cash. I didn't hear that mentioned. I think we want to encourage other forms, but I did not hear a requirement that we don't or won't be able to take cash for payment. Is that accurate?
Correct. It's not a requirement. You can take cash. Correct, Joe and Pam?
Yeah, you can take cash. It's if you're going to go down like the preferred is touchless methods, other cards, but we are not saying you cannot do cash. And as hand hygiene needs to be practiced properly.
Okay. Frequent hand washing, and as everyone knows, you already have to have a person in charge. Typically, that's someone who's had a ServSafe certification, but someone who's really in charge, making sure that every hour you're open, we are monitoring the health of employees and enforcing our safety plans. Julia, did we get any questions ahead of time on this requirement?
So we have gotten questions about safety plans, and our team is working on a template that can be customized for each site. So I wanted to make the folks on the line aware of that.
Okay. Sam, any questions from the chat room on this requirement?
So it's not around adequate hand washing, but it is around safety and L&I. Sanitizing with approved sanitizer under normal conditions, but the CDC recommends 1,000 parts per millions based. They want to ensure that if they're following the CDC guidelines, they will not get a safety violation from the Department of Labor and Industries.
Could you repeat what you're asking, please? Sorry.
Yeah, so approved sanitizer is between 100 parts per million of chlorine and 200 parts per million chlorine. And the CDC is recommending 1,000 parts per million chlorine based. And so they just want to ensure that if they're following the chlorine or the CDC's guidelines, that L&I recognizes that is temporary and through this crisis, and that there will not be penalized, and clarification around that.
I'm going to have to get back to you. That's a big question. There's a lot of disinfectants that can be used, and this is really specific. And I don't know that requirement. I'd have to look at it, but I can get you a more in-depth answer.
Yeah, this is Joe, and I we do have to get back to you on that. But I would say that I think that the 1,000 parts per million is not specific to food establishments. It's for, like, if you're at home and you have people isolated in home care. So we need to look into a little bit further to make sure we know where that's coming from, because that's a huge amount of chlorine that we don't normally recommend unless, like maybe a norovirus outbreak, and this is not that. So we'll have to get back to you on that one.
Good question from the chat room. Always love it when you stump everybody on the panel.
Well, part of it too is where they found it. I'm not sure where. We have to find out where that 1,000 part per million recommendation is coming from. Because CDC is a big. There's a lot of websites. And I don't know if it says.
Okay,
One question that has come up that I have not brought up yet, and I think it fits through here, are some HIPAA concerns. if an employer or a person in charge is requiring that an employee certify that they do not have these symptoms, will it violate any HIPAA laws, or because of this new guidance, is it allowed? I think clarification on that.
So I know that the information that we have traditionally gathered in a food establishment on employee health is HIPAA protected. So we're talking diarrhea, vomiting, jaundice, those types of things that are listed in the food code are protected. I don't know how that extends to a pandemic. And we're talking about a little bit different symptoms. I mean, sore throat with fever is in the code, but it doesn't specifically say, fever with loss of smell or loss of taste or some of the other symptoms, uncontrollable chills. Those things are not in the food code. So I don't know for sure. I'm assuming that it is because of the pandemic that we're in, as obviously a really horrific worldwide event. But I cannot tell you for sure, and that'd be something we'd have to ask some of our kind of more of our healthcare side of things at Department of Health, other than us for sure.
Sam, maybe that's something that we can move forward.
I feel pretty confident though that I feel pretty confident though that you're doing, what you're doing is going to be protected. But we can look into that and get you a definitive answer outside of this.
Okay. We are at the end of all the requirements we wanted to get through. Again, as a reminder for folks, we're continuing to work with the governor's office on the customer registration and what that might look like, and that we will have a second webcast, just liquor control board, because a lot of their questions are unique to that area. We're trying to get that scheduled as soon as we can.
And Anthony, I'll add, we're also working on a HR specific webinar, so that I know the questions about employee screening and sickness certainly would align with questions about employee leave options and what's available to employees. So we're also working on an HR centric webinar as well.
Great. Julia, thank you so much for that. So we have more webinars coming up to try to help you get through this, and be ready to serve. Before we lose too many more people, Pam and Joe, we can't say thank you enough. I know you don't have all the answers, and it's always stressful to go in front of 400 people and try to answer the best you can. And we really appreciate your time and your efforts to keep us all safe.
No problem. Thanks for your partnership, and thanks to all those who attended and asked some really great questions. We appreciate it.
Yeah, and I want to thank you as well. And just to let you know, so I'm actually consultation for Division of Occupational Safety and Health. And if any of you are, want us to talk to us about this, show us your safety plans, we are the ones that we don't cite you, we help you. So please feel free to reach out to me.
Thank you.
Thank you.
We are going to be taking, this is going to be recorded, and it takes, I think, a day to get it all down. But if there's members of your team you want to share this with, we will be breaking this up into the different sections, so you don't have to watch all 90 minutes to get to the part you wanted to share with your teammate. And that will be posted on our website, Lex, hopefully. What's a good time, Lex, do you think?
By tomorrow?
Okay, by end of business tomorrow. And so we'll get this up as soon as we can. If we beat that, we'll let you know. But thanks for all you do. We really have been entrusted to be in phase 2. So to the degree that you can pass this on to everyone in our industry and let everyone know how important it is to do this right. We want to stay open once we're open, and we want to build the confidence in the public that we are ready to serve. Sam or Julia, anything else you want to close with?
Oh, just again, thank you. And we are continuing to provide additional resources. I'd also do a shout out to our hub. We are posting resources there every single day. So that's just a link straight from our website.
Great. Sam, you did a great job in the chat room today. Anything else you want to share with the group?
No, thank you for allowing me to monitor it, and I'm sorry if I missed a question.
And all the questions in the chat room, we do tend to follow up with. So Lex, technical support and making sure this was a great webinar. Thank you for all your work. And everyone be safe, and let's go get ready to serve.
Thank you.
Thanks.